Welcome back, everyone. It's Tim Richter here from the Canadian Alliance to End Homelessness. Pleased to welcome you back at Keynote Plenary. Hope you all had a good morning and was able to jump in on several of the sessions, and it was great to see so many people engaged and connected. I would encourage you, if you want to chat with some of your colleagues, you can use the chat function on the bottom left. Reach out to any of the presenters, any of the attendees of the conference, and have a conversation. These virtual rooms are a little tough to connect, but it makes it there's a great opportunity for us to have a chat with one another. This is, after all, the annual meeting of our movement. It's good to be able to connect with folks from across the country. I also encourage you to have a look at the social feed, and you can post observations, questions, comments there. And if you check out the social feed, I've posted a link to some of the videos from our Pandemic Heroes video contest. I encourage you to have a look at that, and feel free to share and comment with your colleagues. So I am thrilled to be able to welcome our first keynote presenter. Dr. Andrew Brazzari is joining us today. You may have, if you follow him online, you've certainly seen him be a vocal and effective advocate for people experiencing homelessness. I've been a long admirer of his work. Something that folks may not know is that we very early on in the pandemic, I would say in January, February, March time, Andrew and his colleagues, some of his colleagues, began to raise the alarm about this virus coming out of Asia and across Europe, and were quick to warn us about the coming pandemic and the potential impact it could have on people experiencing homelessness. And as we talk today about pandemic heroes, Dr. Brazzari is one of those. He and his colleagues that are involved in the healthcare world, specifically those working with people experiencing homelessness, were the ones that helped us very quickly get organized. In March and February of 2020, we didn't actually know what to do to respond to a pandemic of this scale, how to protect people experiencing homelessness, how to put in place the protections necessary, how to do isolation and quarantine. And he was among the physicians and experts that were quick to get the material out to us. Many of you would have referred to the resources on the Canadian Network for Health and Housing of People Experiencing Homelessness, the CNH3 website. Well, he and his colleagues were instrumental in putting that together. Dr. Brazzari is a primary care physician and executive director of population health and social medicine at the University Health Network. He holds academic appointments as an assistant professor in the Department of Health Policy, Management, and Evaluation at the University of Toronto, and is an adjunct faculty member with the Mailman School of Public Health at Columbia University. Dr. Brazzari is a founding editor-in-chief of the Harvard Public Health Review and has published in top academic journals, including the American Medical Association Journal, the British Medical Association Journal, and Health Affairs. Dr. Brazzari completed his medical training at the University of Toronto and health policy training at Princeton, where he has a Master of Public Policy at Harvard University, where he has a Master of Science. He has maintained active research as a visiting scientist at the Harvard T.H. Chan School of Public Health and as a senior fellow at the Wellesley Institute. At UHN, Dr. Brazzari is working to develop, evaluate, and scale new models of healthcare delivery for patients with complex health and social needs. During the pandemic, Dr. Brazzari also serves as the co-lead of the Ontario Health Toronto Region COVID-19 Homelessness Response and is a member of the Canadian Medical Association's Post-Pandemic Expert Advisory Group. Prior to joining UHN, Dr. Brazzari served in senior advisory roles in the provincial and federal government of public policy issues, ranging from primary care reform to the implementation of pharmacare. With that, I am thrilled to introduce Dr. Andrew Bizzarri. Welcome, Andrew.
Thank you so much, Tim. I feel like you had your opportunity to roast me with the bio. I was hoping, it's not one that I've written, but gets, sent by the university, in terms of, I just wanted to start from a place of humility and thanks in terms of the invitation to be here, and knowing that we're occupying these virtual spaces. I just really wanted to start by acknowledging that this is the National Treaty Week, Awareness Week, around the treaty signed by Indigenous peoples with the Crown and how they have not been respected, or there's not been the mutual benefits that were promised and agreed to. And as we are in this virtual space, and Tim, you mentioning it's about pandemic heroes, and talking about post-pandemic, it is really hard for many of us who, for everyone in the room, in terms of what people have been through for the last 18 to 20 months. And so knowing we're nearing 30,000 people lost to this pandemic in Canada, and just how, there are so many people in the room who have been doing all of the work across the country to save people's lives. So I just really start with my gratitude for what everyone has done. And it's too bad that people can't connect to meet each other in person, something like this again, if there's so many heroes in terms of what needed to be done over this last stretch. And I would really just, again, in terms of the place of humility of starting this conversation of knowing that so much of what we've and have been talking about homelessness has been happening, and about housing and dehoused and underhoused peoples has been happening for decades. And really just the sense as well that just how much of a learning curve, though, this has been for me, for our team, but I think to get to hopefully for our system and our society and the health system. So I will start, and I thank you for the tutorial as to how to do this in terms of running through the slides. But I feel that this is really in terms of where I think there needs to be this reckoning of understanding around, people have, again, in this room, so many have been advocating and fighting for the human right to housing for so long. And really, if we're going to come through a pandemic and not recognize, and continue to fight through a pandemic and not recognize that there is no universal health care without the human right to housing, that to me has been one of the fundamental truths. And I think, again, many of us have recognized this in the work that we've done pre-pandemic, that there is this, real sort of moral aversion in the country around, again, talking about what we're willing to spend and do around healthcare and in different neighborhoods, but this real systematic neglect of people surviving homelessness, and I have to credit Lana Fredo, who I've learned so much from, who's also always told me, when people say people experiencing homelessness, it's not, what she would say, whitewater rafting. This is really about survival. And so again, I'm, really just privileged to be able to have this conversation with so many folks, and the solidarity that continues to need to be there. And I think if we don't see that with the health system for people who are experiencing homelessness, about how we need to shift and think differently, and even just really cast our own equity principles in healthcare, in that contrast, the fact that there's still tens of thousands of people who are dehoused and without housing, we cannot shirk that any longer, would be, my argument, and one that many have made in this room. Getting the handle of this clicker. And so, I think a lot of this, again, about starting from the place of trying to best understand, what the histories in some of this have been, as we try to connect and tie some of this to hopefully the learnings and the journey that we've had in the healthcare space. But I think one of the most humbling exercises is, I think there's, where I work in a sort of downtown academic hospital, all these views about all these things that we're doing in health policy or healthcare as being really new and innovative. But if you go, if anyone goes back, and especially for us in the work, to read at that time Minister of Health and Welfare Lalonde's report on the prospective health of Canadians, again, not about healthcare, but about health and population health, it is very humbling just about how much of this has been talked about, put forward in compelling ways, since 1974, which is again over 45 years ago. And I mean, one piece on this, which is still astounding, is we had a Minister of Health and Welfare, which already showed that the system seemed to be, in some ways better integrated. When we think about right now, if you look up the road, we've got a Minister of Long-Term Care, a Minister of Health, a Minister of Mental Health, and so much of this fragmentation that has been driving some of the very poor and damning outcomes that we've seen through the pandemic. And one line in the report, as sort of in preparing to have the conversation with everyone today, was just around the fact that, again, this was predicted, that, again, with poverty and the fact that if we did not address all of these social determinants or structural determinants, and this is again within 10 years of there being a Medicare Act in the 60s, Minister Lalonde and his team had predicted that we would not see the kind of health outcomes that we would aspire for with the universal health system. And that with the state of poverty, that this is something, again, where there was a lack of adequate housing, and that we would need to pay the same attention to these issues around health and social services and supports as much as healthcare. And at that, the time it was considered a provocative report before the Black Report in the UK and other areas in terms of other jurisdictions. But one of the things to look at is how closely did we follow those recommendations? And I think the answer is clear for people in the room. But when we look at some of the data that colleagues in Alberta were able to pull together across all different provinces over the period from 1980 to 2011, we've seen that the governments did not follow that advice, that recommendation, and that report in terms of ensuring that we were seeing more equal and equitable spending on things that we know drive health outcomes beyond and before a healthcare system. As we can see, again, from a period from 1980 to 2011, we've seen this rise in health spending across all provinces, and not seeing that same lift, again, around housing and education and supports that have been needed, so vital in terms of people's health. And again, I think the argument, as well as when you look internally within Canada, we see this real sort of deviation from where the spending on things that we know primarily drive better health outcomes. But if we compare ourselves to other OECD countries in terms of how much we're spending on health and social care, we actually don't rank all that well. We can be spending much more if we are very serious about actually ending homelessness and improving health outcomes for people that have, and communities that have been neglected for far too long. I keep wanting to hit this keyboard, but I gotta click this, so apologies. And great to see it move so seamlessly. But as we move in this conversation now about COVID-19, as Tim mentioned again about what has happened through the pandemic, and everyone in this room and the work that they've been doing and the experiences that they've had would have been able to predict who would have been affected most. And again, I think been fortunate to be part of a larger group of individuals and teams across the country that have been trying to push early on about how to prioritize people surviving homelessness and various communities, knowing that there have been such strong historic inequities. But when you look at, again, a fantastic paper and study by Dr. Richard in Ontario, the disparities were damning early on in the pandemic, and would argue continue to persist in terms of what COVID-19 had meant for people surviving homelessness. In terms of 20 times more likely to be admitted to hospital, 10 times more likely to be in the ICU, and 5 times more likely to die. We again talk about the numbers and all of the hurt that we have been through in this pandemic. And I think the other aspect of when we look at, what COVID-19 exposed, I think there's been these conversations around the country about how much more, quote unquote, visible homelessness has become. It also became incredibly clear that how much we've failed on the human right to housing for decades in this country, and the fact that being able to physically distance was a privilege and not a right, and that was not afforded to everyone. And so we've seen this again around essential workers having to go out to work to provide the supports for folks to be able to stay at home, but in its most severe degree as well for people who did not even have the right to shelter that was safe or in a way that could help protect people from COVID. And so this is, again, I think just such stark inequities that we've seen through the pandemic, continue to see, but of course that really disproportionately burden people surviving homelessness. And again, again, this is something where we've seen these damning trends for far too long of healthcare access for people, again, surviving homelessness. And I find in the whole thing that there was this conversation early on to say, well, how come and why do people who are without housing have a harder time, accessing the health system or staying healthy? And I hope that's one piece of where we've, as a society, can really push past in terms of understanding that. I mean, for so many who work in the sector, had lived experience, and the great speakers and presenters here who've been really helping drive and influence the conversations with lived experience, that is so clear. What has also been clear is that when you map healthcare access for primary care, for things, again, that we believe that everyone in Canada should have, we see a real flip of when we start to look at the maps. And I think, again, there's been such great work by people across the country about these tale of two pandemics, or tale of 2 or 3 cities. And again, we saw this come out in a way that was unimaginable for some, but too much of a reality for others, where we've seen, again, I think to the far left, when you look at income in the distribution for the city of Toronto, and then where primary care access has been for many decades, there's a complete alignment in terms of family health teams, in terms of, sort of the gold standard of multidisciplinary care, or the most funding for primary care happening in the most affluent neighborhoods. And of course, we saw the flip happen with COVID-19, of where it was happening in areas without primary care, where there was immense poverty and underfunding. And that same thing continues to hold true for people experiencing homelessness. But I really, again, I'm here to provide and offer just all the gratitude for all of the healthcare teams across the country who've been making, just breaking ground to ensure that people are getting access in ways that the system has been funding in the complete opposite direction. And so I think that's something where these maps can no longer be ignored as we start to look at how we want to redesign the health system, let alone address the issue around homelessness. And again, I think, it's been so clear for people in the room, but wanted to ensure that we sort of had the latest data that we've had from Toronto in terms of the street needs assessment from 2021, from earlier this year. But, it's often said that, homelessness and health are inextricably linked. And we see this, again, in the most stark ways, most recently, when we're looking at the sort of health challenges that people are facing. And again, between people surviving homelessness for less than 6 months versus people over 6 for a sort of chronic state, it is incredibly clear just how tied and how we cannot disentangle these issues, and that they really are bidirectional and running both ways, about how we have continued to allow people in poverty to be punished in our country. And, I think the other aspect, again, of just trying to have an update with the latest data is just the state of homelessness, of chronic homelessness, of how long we've allowed this to persist. When we go back to the thinking of 1970s, where there've been call for the more building of social housing and supportive housing, and what the shelter system was really meant to serve. We are now at a state of chronic homelessness, of where, close to a quarter of people are living in that perpetual state for more than 5 years or longer. And it's something that, again, where we just cannot accept that as a society, especially coming through the pandemic. And I think this these surveys and this data is just so powerful in pushing back at many of the myths about what actually the use of the shelter system has been like, and help hopefully drive and influence what we need to be building or coming through in whatever post-pandemic state can look like. I think the other element that we have not been, as a healthcare system, willing to recognize in the way that we have to be, is the systemic racism of homelessness and the systemic discrimination of homelessness. And when you look at just how disproportionate the impact, how racialized homelessness is in this country, of Black and Indigenous communities, bearing the brunt of close to 50% of homelessness in Toronto with the latest street needs assessment. We cannot try to separate these issues around just how vicious the systemic racism of homelessness has been, and how it continues to be an issue that we see in our own healthcare system, both in the way that we care for people or have not cared for people, have caused harm for people, but in the elements around how to build trust and why there is rightful mistrust in communities, especially for people who have been surviving homelessness, where we have not prioritized the healthcare system, the needs of people, where we see this intersection of race and homelessness. And again, I think speaking to the fact that we've known for decades from the incredible reports and work and advocacy from people in this room, but speaking to just the hold of systemic discrimination, that we've not seen the action that people deserve. And if we're not going to do this now, coming out of pandemic, then I think many in this room have been questioning when. And I think this is really the point in terms of how we have failed people on human dignity. And that's the first and foremost point. I think we're talking about homelessness. Of course, there's been, when we look at just how terrible that this has been and how damning it has been, by the way, of what kind of terminal illness homelessness has looked like. We've seen, again, many reports and studies across the country showing that individuals that are surviving homelessness are expected to live half as long. You cannot think of a worse outcome that we have allowed to take place over and over again. I mean, it is hurt and suffering on repeat, and it has been clear and documented by incredible groups across the country. And that, to me, is where we have to look at the sense of that moral failure of not delivering on the human right to housing. And of course, there's been some incredible work from people in the room and across the country around just how both ineffective and inefficient the current system is, and how, looking at some of the randomized trials that have been done and other evaluations about how there is such a, economic argument that's coupled to the one around dignity and health equity. But when we start to look again at every element of this, we know what needs to be done. We've seen both, observational reports to randomized trials to the most compelling stories from individuals. And again, I hope we can push people in the room around this issue in terms of just the systemic discrimination of people experiencing homelessness, on policymakers and decision makers as to, the accountability for why we have not seen the action that people deserve. And I think the other aspect of this is that we know many things that need to be done. There's countless reports, countless studies, and terrific evaluations, but we're also not investing in what we know can work in our own healthcare system. I think when we look at the image here to the left, there's a huge spend on healthcare of close to $65 billion, probably most recently in the last year. And of course, this number is only going to continue to grow based on what the pandemic response has been. But that 0.03% is about the money that's dedicated to understanding what's been working, what may need to be done differently. And that's something that we can no longer afford to have. And again, we have to be acting on the things that we know work and better understanding how we can provide care for people who have been marginalized and shut out of our healthcare system, and be able to ensure that the voices of people with lived experience are centered with the research and work and evaluations that are happening. And right now, I think the argument is that not enough of that is happening, both from a spend, but also from a process perspective and how we engage and do this work or have not done this work as a health system writ large. And I also, in terms of be able to bring, this image that, really did stick with me in terms of when we talked about some of the work that has happened across the country. And again, to give kudos to so many of the cities and teams that early on in the pandemic said that there was no way that people were going to be able to survive in shelters. And the leadership from people living in shelters, people who were experiencing homelessness, to step out and be able to do what best to take care of each other, but from the health and community teams that came together. And one of them, in Toronto, was at a COVID-19 recovery hotel where there was the neighborhood group, Parkdale Queen West Community Health Center, Inner City Health Associates, Inner City Family Health Team. And really what we're looking at with respect to the City of Toronto and University Health Network coming together to lift this up as quickly as possible. And it was interesting, in terms of this individual story that was captured, Mark, in the Globe and Mail. And I guess when I saw that story, I felt some hope, because it was really presented in a way that how could we ever go back to when people, we've recognized that every individual to have their own room and space and bathroom, and what could be mobilized in such a pace where there was not that kind of action before, that was happening in a matter of weeks or months. How could we as a society go back? We've recognized this through a pandemic. And I still try to cling to that hope. And again, I think that there's been, some incredible learnings that have taken place in terms of how the health and social care systems need to work together in a way that wasn't happening before. But also, I hope the recognition, again, when people talk about visibility or seeing people outside, that what we're really talking about is that we can't accept homelessness anymore. That all of these have just been the systems of these, structural and manufactured vulnerabilities that have been imposed on people, and that there was a larger, hopefully, awakening of this throughout the pandemic. But really hoping that we start to see that happen. I think for us as our team, we're trying to really ensure that it's happening at the local level in the way that we're trying to approach the work in the healthcare system or at the hospital, in terms of the different types of partnerships that need to take place. And really just the hope that we can start to see that at the larger level, in terms of different levels of government needing to work together to end homelessness and to build on these stories. And I think really the most important part in this is, I hope that it's the voices of people who have had to suffer through homelessness that become centered. I mean, I always really took exception to whenever people speak about, our colleagues, people about, well, there's, voice for the voiceless. I mean, we've never had voiceless people in a sense. It's the fact that, there have been a silencing of people's voices. There have been a neglect of the voices of people that have been having to be subject to this, this punishment of, again, when you're thinking about living half as long as other neighbors or affluent neighborhoods. So I really hope that we start to see the system change, but really being able to ensure that we are re-engineering and recalibrating how we are designing certain systems and how we are ensuring that these voices are in the center of what needs to be done, in alignment with a lot of the learning that has taken place, and the great work that this organization and many across the country and world have been doing about human right to housing. And I will go to my last slide, I believe. I feel like everyone's messaging me or prompting me to go faster. But I think on this piece that, going back to the Lalonde report, to come as close, to full circle on this conversation, is, the last line of the Lalonde report really stuck with me in thinking about this talk and thinking about what our communities have been through for the last 18 months, is that we really need to see all levels of government and this come together from both a micro, meso, macro level if we're going to be serious. And these calls have been made again back since 1974. Earlier, we've seen this take place during the financial crisis of incredible housing advocates making the case that, again, if we're not going to learn in a global financial crisis, when would we learn? And now we're faced with a global pandemic. And I just hope to sort of end with some hope that, and that to be whatever pragmatic optimism can be there, that we can sort of cling to, that we can learn from that, and that people in this room who have been advocating, that we can start to see that shift from policymakers, from the broader public about what needs to be done, and that we're going to need every level of government to come together to finally end homelessness, but also start to see a truly universal healthcare system and the way that we can start to better partner with each other and listen to each other. So very grateful again for the invitation. I don't know, again, Tim, maybe over to you, as I've not been neglecting my chat, but really appreciate the time.
Yeah, well, thank you, Andrew. This is really super. I've been following your presentation and following the conversation online, and people are very excited about what you have to say. Now, I did promise there was a Q&A, but we got a little bit of time, so I might ask you a few questions if you're willing and able. But the first thing I'm curious about is how you see the rest of this pandemic unfolding. We've got a lot of folks in the room who are sort of working our way through the fourth wave and are struggling to keep people safe. But I'm curious to how you see the rest of the pandemic unfolding for people experiencing homelessness, and any thoughts on how we might prepare.
No, yeah, thank you, Tim. I mean, I think that one, it's the recognition that we're still in a pandemic. I mean, I still think it's sometimes, it hits you in such a way when you're hearing some policymakers or politicians, acting as if this is fully in the rearview mirror, and speaking to certain, parts of the population that this is over. I mean, again, this always speaks to how differential the impact of the pandemic has been. That again, what the experience has been for people who could afford housing, have places to live, or have jobs that allow people to work from home. In terms of where people question just how real the pandemic was. We're again nearing 30,000 deaths, and just how disproportionate the burden has been on people throughout this is something that I think fundamentally has changed so many of us. And I think that that's one piece, is just the recognition again, and also knowing that this is a national conversation, that there are provinces, again, where you look at public policy decisions being made that have devastating impacts on whether, ultimately people live or die. And that's been the most harrowing part of this, is that this has been so driven and shaped by public policy decisions, as we know, again, about the issue around homelessness for decades or centuries. And I think in terms of where, what does this mean, or so how does we see this unfolding? I mean, I really believe that this is not going to go away in the way people would like, or certain politicians or policymakers would like, for people surviving homelessness, because there are such historic inequities. And when you're looking at what this could mean for the shelter system and the safeties that are there in terms of what vaccine uptake can look like, the rightful mistrust of people of the healthcare system for people who have been surviving homelessness, what those kind of dynamics look like for safer settings and spaces, and the investments that are going to be needed, for ventilation, acknowledging, COVID as an airborne disease to spread, what that's going to mean in terms of the quality and adequacy of a standard to housing, and what kind of relationship, new sort of relationships need to really be entrenched with healthcare systems and public health systems to ensure that safety is there. But all, I think, along the sense of, that it can't change or dissuade the view that we know what the learning through the pandemic was. We need to end homelessness. And the longer that we continue that, this is a pandemic for people when you look at all of the data around life expectancy and the health comorbidities. We would not, if it's that clear, how can you ever allow that to continue to happen for people when that is the epidemiological data that's coming back for people surviving homelessness? So I think, it's hopeful that, again, with vaccine rollout, which we've seen, some real pockets of success and more broad success now across the country, the sort of measures and not, pulling off the public health measures that have kept people safe. We're seeing other jurisdictions slip back. The hope is we see that continue, but we need to be thinking from a different social policy lens on this question.
It strikes me that I remember we were looking today at, the relationship between the homeless system and the health system and the homeless system. And we're seeing improvements in those connections, but it was striking at the beginning of the pandemic that public health was nowhere to be found when it came to protecting people experiencing homelessness. And it felt to me, and I could be wrong, but it felt to me like there were structural biases in the health system that meant that they just weren't there for the homeless system at the beginning of the pandemic. And I wonder if you have any thoughts on how do we as a housing system and a homeless system improve that relationship, take on some of these structural biases in the health system, and how do we improve healthcare for people experiencing homelessness and work together, as you say, on the obvious need for the end to homelessness?
Yeah, I mean, Tim, I think the structural discrimination facing people surviving homelessness is everywhere in our healthcare system. It's everywhere. When you think about the language that we use, that's, in terms of, loss to follow-up for people. I mean, it's not loss. We've not been looking, but that's what you have to write in your medical notes about people, aren't able to come into the hospital for an appointment. But of course, how can they come in when they don't have adequate housing, or they're underhoused, or they're really in the throes of homelessness? But we've created these systems of how to distance and service different parts, and not, want to have true sight into what the realities are for people surviving homelessness. So I think, again, and this is from, mentors and leaders in this room and elsewhere, that in the healthcare system, the housing system, that have been pushing on this for decades. And again, my hope is that we see more of this recognition of that, and that we see real changes. And again, just how we are delivering care. I mean, one of the pieces, Tim, is the systemic discrimination also comes into the fact about the way healthcare is funded. I mean, when you think about how primary care is funded, there's no accounting or adjustment for people for social factors. Funding mechanisms of primary care are baked with systemic discrimination, and in terms of where family health teams are going to be, where these resources are going to be, and they're almost every time away from people experiencing homelessness. So I think, the great work that people are doing in the housing space and the human right to housing and housing advocacy, I think, is really starting to come through within the healthcare system. But I think you've really hit it in the sense that we have to call out the structural discrimination, and we need to see real reforms from the way that we fund healthcare, the way that we're funding supportive housing and the social supports, and social housing, to ensure that people are able to access the bare minimum of human dignity that we would expect. So, I'm staying hopeful. Again, I don't, today, I think, it's usually, 6 to 7 days. It's just been like, in this view of like, have we learned did we have a moment to do this? And sometimes you don't feel like it. But I think, again, for many of us that have the privilege to keep going with this work, you have to stay hopeful that there are going to be these changes. And there have been some real, I think, advances when you look at what people in this room have done in various cities to bring in public health and bring in healthcare systems that may not have been, on the radar before. So I would, just again, give kudos to everyone in the room who's been doing that, because my hope is that can have a real lasting impact.
Awesome. Well, thank you, Andrew. We're getting to the close of our presentation. I think I was watching the chat, and I think there's an awful lot of questions. I think we could happily stay here all afternoon and talk to you about this and listen to what you have to say. Really appreciate all the work that that you've done, all the life-saving work that you've done. We said this morning just how battered the homeless system has been, and our folks that we serve, how challenging this has been for them. And I can't imagine where we would have been had it not been for you and your colleagues and coming to the aid and assistance of people experiencing homelessness. And I also want to thank you as well on behalf of everyone in the room, in our virtual room, as it were, just for your advocacy and your voice. And I know that in policy circles and political circles, people are listening, and in health policy, people are listening to you. And so just to say, we really appreciate the work that you've done and the voice that you've been providing to this work. So thank you very much, Andrew, and certainly look forward to bringing you back to this to the conference, hopefully when we can meet again in person.
Yeah, thanks so much. And I hope to meet more and more people in person, and just a lot, just grateful to be invited and be a small part of this week. So thank you so much, and look forward to meeting in person one day soon.
Right on. Thanks, Andrew.
Thank you.
All right, everyone, that will wrap our lunch or keynote presentation. We'll be heading off to concurrent sessions now. Just to make sure that you come back at 2:45 Eastern time for our wrap of the day. We'll be playing our first of our Pandemic Heroes videos for you. So we had our Pandemic Heroes video contest. We'll be playing the first of those videos. We're putting them up on social media as well. Please feel free to have a look at our website, conference.caeh.ca. Also, have a look at our CAEH21 game. Make sure you are engaging in the conference program and engaging with your colleagues, and get a chance to which enters you to win a free registration to the next national conference and one of 5 copies of Tanya Talaga's newest book, All Our Relations. Tanya will be our keynote speaker. And in the few minutes you have before we move to our concurrent sessions or on a break, please feel free to jump in and visit our social lounges, which you can find through the menu bar at the left-hand side of your screen. With that, thank you very much. I am looking forward to seeing all of you in our concurrent sessions and back here at 2:45 Eastern. Thank you all. Take care.